Hey guys, Dr. Marissa Marquis with Restore Family Chiropractic. Today I want to talk about common questions that I get asked about chiropractic and pregnancy. The very first question I get asked is chiropractic safe during pregnancy? 100% absolutely safe. Before we ever do any adjustments or anything in the office, we sit down and we do a thorough history, examination, orthopedic testing, and chiropractic neurological exam to make sure that you are a good candidate for chiropractic to begin with. The next part with chiropractic, with the adjustments that we do, is we always have you loosen up and warm up your body and your spine. Just like before you'd work out or exercise, you want to get the blood flow moving so that you have the best exercise, best workout. With the adjustments, is get the blood flow moving so that you can move the best and get the best adjustment and the best alignment. The second thing with that is when we actually adjust you, there are very specific techniques that I utilize. One's called the Webster Technique. The Webster Technique is specifically for adjusting the spine, the pelvis, the sacrum, and all the supporting ligaments and muscles around and supporting those areas. And it's utilized primarily during pregnancy. And what it is, though, is it helps to restore normal balance and alignment. So from that standpoint, there's nothing we're putting into your body. We're not taking anything out of your body. We're literally working with your body to reduce interference and reduce stress to your nervous system and to your body so that your body can function like it's supposed to. You can feel better, move better, have better sleep, and just have a very healthy, much healthier, smoother pregnancy and labor and delivery. If it was not safe, I would have never gotten adjusted myself during both of my two pregnancies. It allowed me to actually adjust. I was working all the way up until a few hours before I went into labor with my son, where I was feeling amazing all the way till the very end. So yes, it's absolutely safe. The next question I get asked is, how does it actually help with back pain or sciatic pain or other aches and pains that I have during pregnancy? And this is a wonderful question because chiropractic doesn't treat back pain. It doesn't actually treat sciatica. It doesn't treat headaches. What chiropractic does is it helps remove and reduce any interferences within the nervous system that's preventing your body from functioning and healing like it's supposed to. Your spine, we work on your spine because your spine protects what's called your nervous system, right? Your brain, your spinal cord, and all the nerves that go everywhere into the body. And when your spine shifts out of alignment, that can put irritation and stress to the nerves, which affects the communication. So when the body's not communicating properly, things don't function. And then pain will often be that last symptom that you get when there's a problem. The tricky thing is pain is the last symptom that you get when there's a problem, but it's often the first thing that can go away. So often people think, oh, my pain went away, I must be fine, but that's not necessarily the case. The tricky thing with pregnancy is you have this amazing hormone called relaxin, and relaxin does what it sounds like. It relaxes everything. So it relaxes the ligaments throughout the body to allow things to move, so that way when it's go time for baby to come, your body can actually birth this amazing baby. With that, though, comes some instability. So as you get farther along during pregnancy, whereas most people, when they get adjusted, they become more stable, during pregnancy, you tend to become less stable, which is a good thing, but it can bring its own challenges. So the earlier that we start working on you, the better. And that brings me to my third question that I get commonly asked is, when should I start? And my answer is, as soon as you possibly can. The earlier that you get started, the more that we can get your body and your spine and your pelvis aligned and all those ligaments supporting it in as good place as possible, the better foundation your body will have throughout the rest of your pregnancy, labor and delivery, and then even into postpartum and recovery, because that's a very important part to remember as well too. Think about pregnancy as kind of like a marathon, right? You're not gonna just wake up one day and say, okay, great, I'm gonna run a marathon, right? And never have trained for that. Think about that. So before getting pregnant is really my ideal time that I recommend women and moms to start getting adjusted is when you think that you want to start having a baby, get adjusted beforehand. One is because the nervous system, you want it to function and work at its optimal so that it can actually help support you getting pregnant or even support you having a healthy pregnancy to begin with. But two, so that your body is already used to being in a good alignment and moving well and being really balanced. So then once all those physical changes start to occur during pregnancy, your body can better adapt to it, if that makes sense. And the third thing is, even if you're in your early part of your pregnancy, first trimester, there's no concerns with anything with that. And I also, even if you do have concerns during pregnancy, I never make a person do anything that they're not comfortable with. So everything we do is about listening to you and talking with you. If you come in your third trimester during pregnancy, when you have all that relaxed and all those ligaments are very loose, that's typically when moms tend to come in if they've never had chiropractic before, because that's when they start becoming more uncomfortable, right? The baby's gaining more weight, your posture is changing as well, and we can do a lot of work to help support the posture and help support your body's changes during that time. So hopefully this gives you some good insight as to how chiropractic could potentially help you during pregnancy. If you do have questions, please feel free to reach out or call us to schedule an appointment. We look forward to hearing from you soon.